Hello, my name is Andrew Holbrook. I'm here from the Edgewood University Library on September 22nd, 2025. We're here in Predalin Hall on the Edgewood campus to record the oral history of.
Dr. Margaret Noreuil.
Thank you very much for taking the time this
I'm
morning.
glad to be here. Thank you for asking me.
I'd like to start with your upbringing. Could you tell a little bit about where you were born and where you grew up?
Sure. Both of my parents graduated from Tennessee Tech University, and my dad's first job was with the Federal Department of Agriculture. He was a market news analysis. And so I was born in Indianapolis, Indiana to start with, but we only lived there a short time and then moved to Atlanta. We were in Atlanta probably about 4 or 5 years before he was transferred to Washington, D.C., and we lived in D.C. for a couple of years. Then ended up in Rochester, Illinois, which is a suburb outside of Springfield. And I was there from pretty much fourth grade on until I got married, and then ended up moving further north to initially Peoria, then Rockford, then to Madison. And when we got here, I said I was moving any further north because this was cold enough. But my upbringing, my parents, I think both really encouraged me to go on to school. It was always, when are you going to college or where are you going to go? It wasn't if you go to college. So that really enforced a love of learning for me and kind of was where it got me started.
Could you tell a little bit more about your family life? Did you
Sure.
have any siblings, for example?
I have two sisters. I'm the oldest of three daughters. So I have a sister that still lives in Springfield, Illinois, and a sister that lives in Cedar Rapids, Iowa. And we're real close. We've always had a lot of fun together. My one sister in Iowa married my husband's brother, which I always have to say that is legal. It sounds like it's not, but it is. And then my other sister is also married. Our kids all had a lot of fun growing up together, and we go to my parents a lot, and they always enjoyed spending time with my parents. So, as far as growing up, we did a lot of fun things. I was involved in a lot of 4-H and the church. We belonged to the Methodist Church in Rochester, Illinois. My parents were real active members of the church there. And so went to church camp, 4-H, Rainbow Girls was a big part of my life at one point. Yeah, had a lot of fun. I was fortunate to have a very good childhood.
Out of all the places you lived as a
Mhm.
young person, were there ones that appealed to you more or less at the time, or that stayed with you as you grew up?
Sure. Probably being in Rochester stays with me the most because I was there for the longest period of time. Definitely remember living in DC because my parents, we were there about 2 years, and I knew we were only going to, or they knew we were only going to be there a short time. So our parents took us to all the museums, and at the time I was about fourth grade. I don't know that I really appreciated it very much, but looking back, I really enjoy going to DC now and revisiting all the museums, particularly the Smithsonian museums. But also just being in DC is a great experience. So I appreciate it now, but I'm not so much sure I appreciated it when I was in the fourth grade. Yeah. So
I'd like to follow up on your education
sure.
because you talked about that
Hmm.
from the beginning. Um, what was your schooling like as someone who moved around so frequently?
Sure. Well, my mother was a school teacher, so that really helped out. And I guess I should say, I think it helped a lot. I think when I was in high school, I maybe didn't appreciate it so much because she often knew what was going on in school and on weekends before I knew what was going on. But she was really good at being available to us and being there. And of course, she was off in the summers, which was really nice for us. So education was just a huge part of our life growing up. Her mother was also a teacher. In fact, her mother, so my grandmother on my mother's side, was a teacher back when you didn't have to have a college degree to be a teacher. She taught in a rural Tennessee one-room schoolhouse. And then eventually, when my mom was going to school getting her bachelor's degree in education, they changed the law that you had to have a degree to be a teacher. So my mother, when she was in college, my grandmother was in college with her at the same time. And they actually graduated the same year. And my mother was pregnant with me at the same time. So we always laughed that all three of us walked across the stage at the same time. But it just, I think, goes to show how important education was for all of us.
I love that story.
Oh, it's kind of unique. And we're all named Margaret because I'm the fifth Margaret in a row. And so my mother was a Margaret. She went by Peggy, and my grandmother was a Margaret. She actually went by Margaret. Her mother went by Maggie. So there's a long history of Margarets in the family.
Oh my goodness.
Yes. Yeah. So.
And I think it's interesting that you brought up the needing a college degree because I think
Mm-hmm.
that's one of the themes that we'll come to later in our conversation about one of the biggest transformations in Edgewood College's history from primarily training teachers
Exactly.
to today
Mm-hmm.
being a school of choice for nursing.
Mm-hmm. Mm-hmm. That's true. When I started, education was the largest major, and that was back in 1993. We had a huge education program, and we were really, as you said, we were known for that. Um, and then, over time, we ended up adding more and more majors, and nursing, particularly nursing, but also business became large majors, probably about 15 or 20 years ago, maybe closer to 20 years ago. Both of those majors became really much larger and more valuable in the community as Edgewood grew.
Yes, and I'd like to expand on some of those changes as we get into your time at
Mm-hmm.
Edgewood. Um, could I ask you to
Sure.
take us through some of the schools that you attended in your own
Oh, sure.
education?
So I started out, actually, I started out at Illinois Wesleyan, believe it or not, for a year, and I was homesick. So, and that was in Bloomington, Illinois. So I moved back to Springfield, and I ended up getting a 2-year associate's degree in nursing. But I did it knowing all along that I wanted to go on and eventually go to graduate school. So I worked as a nurse in the intensive care unit at St. John's Hospital in Springfield, Illinois, and commuted to the University of Illinois at Champaign and ended up getting my bachelor's degree there, and then continued on and earned my master's degree in nursing from U of I. At that time, the nursing program was based out of the Chicago Circle campus. So even though I attended classes in Champaign, my degree came from Chicago. Um, and then we ended up moving, like I said before, to Peoria and then to Rockford. I continued to work as an intensive care unit nurse over the years. And then when we moved to Madison, I was kind of ready for a change. And I ended up seeing a position in the paper for a part-time faculty member in the nursing department at that time at Edgewood College. And so I applied and started teaching part-time, and I just loved it. I worked with a friend from Milwaukee who was an emergency department nurse. So we both had critical care experience, and we really enjoyed working with the students and learning a lot from them and hopefully teaching them. And then I decided I wanted to be full-time here. So I was told, well, if you want to be full-time and a tenure line, you have to get your PhD. So more school, but fortunately UW-Madison's here in town. And so I started going there. And the department chair at the time, Dr. Mary Kelly Powell, was really good about making sure that the courses I was teaching were at different times than the courses I was taking at UW. So that way I could go to school and continue to be either full or part-time here at Edgewood while I finished my PhD at UW-Madison. So my degree at Madison is a PhD in nursing with a concentration in child and family studies. I think today it's called human ecology, or they might have changed that name, but that was my secondary concentration. So that was fortunate for me that there was a good school here in town that I could go to and finish my doctorate.
And before we started recording
Mm-hmm.
the interview, you mentioned that being a doctor in nursing is a notable thing.
It's
Could
unusual.
you explain a
Sure.
little more about that?
Sure. It's not as unusual today as it was back in the day. Before we had the doctorate in nursing practice or the DNP, your only route for a doctoral degree in nursing was a PhD. So at the time I graduated, just think when that was, 2002 maybe, there was probably only about 5,000 people, nurses in the United States with a PhD. So that was pretty unusual and oftentimes unheard of. Since then, we've added the Doctorate of Nursing Practice, which is a more practice-focused degree. In fact, we offer that here at Edgewood University now. And so there's thousands more nurses with doctoral degrees, which is great because we need it.
Were you always interested in nursing? I'm curious about your
Sure,
intellectual interests,
sure,
really from childhood.
sure. That's an easy question because my mother actually had a picture of me standing in the driveway in Atlanta with a Halloween costume on as a nurse. So, and that was back when you had the little white uniform and a blue and red cape, and I had like a little bag. And so I don't really remember ever not wanting to be a nurse. And sometimes I thought, I wonder if I'd enjoy doing something different, but I guess I'll never know because that's what I've always wanted to do. And I ended up starting out being interested in nursing, and then I became a candy striper, which most people don't even know what that is anymore. Do you know what that is?
I don't.
I ask the students when they start our nursing program every semester. I go in and introduce myself, and I give them a little information about my background. I tell them I started as a candy striper, and I always say, "How many of you in here know what a candy striper is?" And 30 years ago when I started, a lot of students did, but every year it's been fewer and fewer. And this last time I did, there was only 2 people in the whole room that knew, and one of them was an older student. It was a volunteer job, and you actually wore this pink and white dress. I think the men had well, they didn't wear a peak. I can't remember exactly there weren't very many men candy stripers, but they had to wear some sort of uniform too. And you pushed around what was called a hospitality cart. And the hospitality cart had mail, because of course that was back before computers or cell phones. So people stayed in the hospital a long time. So they'd actually get mail while they were in the hospital. We sold newspapers, we sold candy, potato chips, magazines, cigarettes, believe it or not, in the hospital. And this was back when patients could smoke in the hospital, and sometimes they were on oxygen and they could smoke wearing oxygen. So students, when I tell them this, their eyes are always they're horrified and I find it hard to believe now, but of course at the time that was no big deal. And you just spent the day walking between the different units, delivering and selling, like I said, candy and cigarettes and potato chips and all kinds of. But it was really a fun job because people were so appreciative of having you stop in and saying hi, and delivering flowers and delivering mail was always a fun thing. So anyway, I did that for several summers in high school and then graduated from there to be a certified nurse's aide. I did the training to do that. That was a really hard job, and I worked in a nursing home for a couple of summers. And that convinced me that I definitely wanted to be a nurse, because being a CNA was just physically particularly demanding and challenging. And I decided I wanted to be a nurse. Oh, I knew all along I did, but that really confirmed it for me that that's what I wanted to do. So then went to nursing school. And I knew all along I wanted to get at least a bachelor's degree, because partly my parents were, that's what they had. And my mom actually went on to get her master's degree. So as I said, education was really important in the family. And I knew that that's what I wanted to do. So I got that right away after getting my bachelor's. But then, like I said, it took me a while to get my PhD. My kids were in school, and I was here at Edgewood at that time. A long story, but that was sort of the route that I took. And I never did anything else. I often wondered maybe I'd like to have done something else, but I never did. So,
Yeah, that's a great story about your Halloween costume.
I don't know. I don't even know where that picture is now. I should try and find it. But at the time, it was like somehow I just knew I wanted to be a nurse. And I'm not even sure how I knew that. But, well, I knew my mom had wanted to be a nurse. And that was back, so let's see, she was born in 1933. So probably early 50s. You had to have the doctor's permission to be a nurse. And so she went in for a physical, and she had asthma. And so the doctor wouldn't approve for her to be a nurse. Can you believe that? So then instead she became a teacher, which, how is that? Any, kids are coming in coughing in your face and sick all the time. So it just didn't make any sense. But that changed the trajectory of her career. And I don't know why she didn't get a second opinion, but maybe she just felt, back then people didn't get second opinions when they went to the doctor. They just believed what the doctor told them. And so it's like, well, I won't be a nurse then. So, and, their options then were nurse, teacher, or a secretary. And she knew a secretary wasn't going to do it. So then she became a teacher.
Right.
Isn't that crazy to think that a doctor's note could change her? I always wondering, doctor go back and say, what were you thinking? Especially because of asthma. I mean, lots of people have asthma. So that's how that happened.
My goodness, what another era.
I know. Isn't that? It's hard to even imagine now that would change your life like that. But it did. People didn't question things like that as much back then.
You started to do this in your answer to the previous question, but I wonder if you could step me through some of the places where you work
Oh, sure.
as a nurse
Okay.
before you entered the field of nursing education?
Okay. So when I graduated, that was back in the day, 1970. When did I graduate? 77. I became a nurse. And at that time, they didn't have nurse residency programs. They didn't have much of an orientation. So I think I had about 2 weeks orientation after graduation. And I wanted to work in intensive care. I'm not even sure why that was the case, but that's where I wanted to work. And looking back, I think that was so dangerous because, patients are really sick in intensive care, and to have a brand new nurse right out of school, um, they would never do that today. But I loved it. I had great people that I worked with, great mentors. I really enjoyed it, and I stayed in intensive care for about 18 years. So I worked in intensive care at St. John's in Springfield, Illinois, and then we moved to Peoria, and I worked at what was then Proctor Community Hospital, which was a small hospital outside of Peoria, not too far, but a little bit outside of Peoria. And at that place, I also worked as what was called the house supervisor, which meant that on the evening shift, I was the nurse that was in charge of everything in the hospital. So that was really a good experience, but also kind of taught me that I didn't really want to be in hospital administration. Um, and so then we moved to Rockford, and I worked at Rockford Memorial Hospital in their intensive care unit for quite a while. And it was interesting because at that time there was a nursing shortage, just like there seems like there always is. And I ended up working what was called 24/40, which meant that I worked 24 hours a week, but I got paid full time. So I worked every Saturday and every Sunday, 12 hours Saturday, 12 hours Sunday. So 7 a.m. to 7 p.m. Saturday and Sunday. And I was 24 hours, and I was paid full time. So that was a really nice situation because my husband was working Monday through Friday. He was the director of respiratory and neurodiagnostic services at Rockford Memorial Hospital. So his hours were Monday through Friday days, and then I worked every weekend. So we didn't have to use daycare or a babysitter or anything like that. We just, I'd be there during the week, and he was there to help on the weekend. So it actually worked out really well. Although looking back, I don't know how he did it. So I had 2 weekends off a year. But you do things to make things work, and that's what we did. And then he got the job. He got a job at Meritor here in Madison. So he commuted for a while, and then we ended up deciding, why are we living in Rockford when we live in Madison? So we moved here, and then that's when I got the job here. I worked at UW Hospital on a part-time basis initially, and then the job came open here at Edgewood, and I started teaching here. And I worked part-time for a while at UW Hospital. And then eventually I had a clinical placement of students at Meritor Hospital in the day surgery unit. And so through my being a faculty member there, they said, how would you like to fill in for people when they go on vacation in the summers? And so I ended up not working at UW Hospital and switching over to Meritor, and ended up teaching during the school year and then working as a nurse in the same day surgery unit at Meritor, probably for about 5 or 6 summers. They were really good at just holding the spot for me, and I'd come back every summer to work part-time. So that's pretty much my clinical practice experience. Things changed a lot over the years.
Yeah, could you expand maybe on some of the changes that you observed during the clinical practice portion of your career?
Sure. I was just talking to a friend the other day who started at Edgewood the same time I did. And we were talking about how much things have changed because we were both ICU nurses about the same time. And back when I worked in intensive care in 1977 or so, patients stayed in the hospital for weeks, especially because with working in intensive care, we had a lot of patients that were having open heart surgery, which was somewhat new at that time. And patients stayed in ICU for about 2 weeks. And in fact, the open heart surgeon often slept in the room at night, the first night or two. It's hard to even imagine now, because now I think they're out of the hospital in just a few days. So, that's a huge change. The other thing is just all the knowledge we have now about blood and blood products, because we almost never wore gloves back when I first graduated. And no masks, hardly any isolation. We really only had patients in isolation during HIV epidemic. I mean, when that happened and AIDS, that's when we really started paying more attention to that. But before then, I mean, there were times I remember working in ICU. We had to, a man had open heart surgery and started bleeding, and the surgeon couldn't get back to the hospital fast enough. And we had to open him up in the room and like manually pump his heart with our hands. And I mean, no one ever wore gloves. That just was unheard of to wear gloves. You just didn't do it back then. Even the surgeon, when he came in, just jumped right in. And so it's hard to even imagine that today, but that's the way it was then. So that has been a huge change. I think all the changes with medication, particularly there was a period where, AIDS was really an issue, particularly with patients coming to the hospital, and people were afraid to take care of patients that had AIDS. And that was a kind of sad period, I'd say, in healthcare when we were going through a lot of that. But fortunately today there's, medications and a lot of things that can really help patients. So that's a good, there's been a lot of good things that have happened over the years too. I'm trying to think what other changes that have occurred. Well, for one thing, the whole nurse practitioner movement, when I graduated, there wasn't such a thing as a nurse practitioner. And when that first came out, there was a lot of controversy. And of course, in some areas, there still is today, just about what they can and can't do. And do they have to be directly supervised by a physician or not? Most states, they don't anymore. But Wisconsin was one of the last states just in the past couple of months that have changed that. So that's been a big difference in nursing itself. Lots of people wanted to go on for graduate school. And now, of course, that's mostly at a doctoral level, which is really a good thing. I think of other changes. Think of anything else often. I mean, there's just been a lot and it just living it, we kind of forget what's different now. But I know especially the whole glove and the worrisome about isolation, the different types of diseases that we've seen changed over time. It's been a lot of change.
Hearing some of those stories, you must sometimes wonder how you made it through.
Oh, I know. I know. I should record this, but I often say, it's amazing I didn't kill somebody when I first graduated, because I think about how sick patients were and how little I knew, and just, you were just thrown in there and okay, here you go. If you need some help, let me know. And think back on that, it's scary to even think about that happening. And I remember, certain patients really well that were just horrible, young people. Oh, that's another one. Toxic shock syndrome. We had a young 15-year-old girl that died of toxic shock syndrome. When that first came on, that was horrifying. So, just different people that you remember over the years, or their families that you remember over the years. It's been an amazing career, to be honest, to experience the challenges and just the things that people have gone through, to be able to help them with that. It's an honor, I'd say, to be a nurse and to help people through those times. You made me emotional now.
That's wonderful. I'm curious, as we start to work our way into the Edgewood era of your career, are there any influences that you see from your clinical practice as you started to become a nursing educator?
You mean people that I worked with in clinical practice,
or any experiences that you had? Was that influential in how you approach teaching and training the next generation of nurses?
I'd say one of the things about working in intensive care is that you're so focused on all the physical things that are going on with the patient, because they're usually maybe not responsive, and there's a lot of machines and a lot of things happening, a lot of medications. And I always tried to really really instruct students in the fact that this is a person, and all those other things, the person needs those things, but those aren't the most important things. See the patient first, and then deal with all of the equipment and the medications. And oftentimes I'd have families bring in a picture of the person who was a patient, because, you see them in the bed and they don't look very good, and they've got all these wires and tubes, and and then you see a picture of them on the wall of what they normally look like, it kind of brings it to real for you. It makes you realize, oh my gosh, this person is a part of a family and they have children, they have parents, and it just makes it so much more human, I guess. And that's one of the things I always think about. That one of the reasons I stayed at Edgewood so long is because I think the nursing program particularly, but really everything here at Edgewood focuses on those values, those Dominican values, so that you see more than just a body in the bed. You see a person, somebody, you have compassion for that person. They're part of a community. So I think that Edgewood does a particularly good job of helping students realize that there's more, especially in nursing, there's much more to nursing than just a body in a bed. But I'd say for everything, for business, for education, I always say the liberal arts are extremely important to all the students here at the college. And I think they sometimes don't get the recognition they deserve for all the work that the faculty do that are in the liberal arts.
What was nursing like at Edgewood when you arrived in 1993?
Well, one of the things that was really nice about when I arrived at that time was that we were really small. There was only maybe 4 tenured faculty and maybe 5 of us that were part-time. So we were really a close-knit group of people that worked really well together. We knew all the students really well. We knew each other. And that really built a sense of community. And that was great, especially for somebody that was a new faculty member and I'd never taught before, which is often the case with people that come to teaching in college settings. So I was really fortunate to have great people to work with. We got really close to the students. We knew them. We often knew their families. It's great now that nursing's so large and probably the largest major on campus now. And I think we have over 200 or maybe 300 at this point, grad students, several hundred undergrad students, which is great because we need nurses. But you sort of lose some of that sense of community as much as you used to have when you were very small. So that part I do miss. We are continuously out of office space for faculty, classroom space for students, lab space for students. Those are issues that we didn't have when I first started here because Edgewood was so much smaller. But on the other hand, it wasn't a good thing because we were really financially struggling when I first started here. I often tell people the story when I started here. There was a gravel parking lot out in front of DeRicci. And when you pulled in, you had to be careful where you parked. So when you opened your door, you didn't fall into like a pothole. It was pretty challenging at that time. But the president, it was Dr. Jim Evan. He had a vision for the college that really pulled us through. And it was somewhat controversial. He built new buildings and added new programs, and some people felt that, we're financially strapped. Why are you building new buildings? And, families and their children don't want to come to a college that looks like it's falling down. And, is it even going to be here in 4 years or not? And so he had a vision that really pulled us through those hard years and gave us a solid foundation for, being successful where we are today. So I give him a lot of credit for all the decisions he made back in the day.
That's true. I mean, he righted the ship.
He did. He really did. I remember when they were building Sonderegger, and that was such a beautiful building, and our enrollment immediately started going up. And, I always thought as a parent myself, I pay attention to what buildings look like and, what do the classrooms look like? And is there equipment in the classrooms that's, new and updated? And so I think he did the right thing. Obviously did do the right thing at that time.
I'd love to go through your Edgewood career in some detail. In the early years as a part-time faculty member, can you reconstruct some of the courses that you taught?
Oh, sure. It's kind of funny you say that because I looked at one time and I taught every course that was in the nursing program, even stuff that I didn't know much about. But it was just, there was a shortage of, like I said, there weren't a lot of people that had graduate degrees in nursing. So I started out because of my intensive care unit background. I started out teaching them med-surg courses, medical surgical courses, which are kind of a lot of the hospital-based courses, and the lab courses, which again is more intensive care med-surg courses. Then over time, we had some leadership courses that I taught, it was called Transit Issues courses. And then, so I did that for a long time. I taught the research course for quite a bit of time. And then Joanne Granquist was the public health nurse at Edgewood, and she was starting to think about retirement. And I was getting sort of tired of teaching medical surgical and being an ICU nurse. And I thought, public health has always been something of interest to me. So, and I knew she was teaching the public health theory course, but also had students up at the House of Wellness in the Ho Chunk Nation up in Bear. So I started going with her to her clinical site, and I enjoyed the population. I felt like it was a really important area for students to know and understand. So as she started thinking more and more about retirement, she was really a mentor for me to move into those courses. So I taught, kind of left intensive care and went to teach more public health, leadership research courses along the way. Then eventually, after I got my PhD, we saw a lot of growth in our graduate programs. So I started teaching at the grad level and taught leadership, the practicum courses. That's mostly what I've taught at the master's level. And of course, now we have a D&P program. I've not taught in that program yet, but I've been a chair on some of the dissertation committees in that program. So I've kind of gone from one area to the other. The one area I taught that I was should never have probably taught was pediatrics. And that's because somebody quit, right before the semester started. They said, would you pick this up? And I said, okay. But I always felt like I was just, one little step ahead of the students. And I was always like, please don't ask me any questions because I'm not sure I'll be able to answer. But we made it through. And, like often happens, you just do the best you can. But that definitely wasn't I'd never been in pediatrics, and it wasn't my area of interest. But that was one of the things about Edgewood, is that we all really helped each other out and did the best that we could to help the students be successful.
So you started in 1993
Mm-hmm.
as a part-time
Right.
faculty member. When did you become full-time?
Oh, that's a good question. I have to go back and look. Maybe 2 or 3 years after that. It wasn't long after that I became full-time. And it was just adding more sections of the courses I was already teaching. So it wasn't long after that, but I'd have to go back and look to see.
But that happened pretty early on.
It did. It
Okay.
did. So, and I was in school at UW. So they said, well, as long as you're in school, we know you're getting your doctorate. So we'll go ahead and put you in. So I was full-time, but non-tenure track. And then once I finished my PhD, they moved me into a tenure track position.
Mm-hmm. Did the focus of your PhD work end up figuring into any of your later teaching and administrative career, or was the PhD more of a separate
That's
part?
a good question. I'd say it was more of a separate thing because my dissertation focused on mothers with chronic illness and looking at their psychological well-being, uncertainty, and I was just going to test, and family hardiness. So this is going to test my thinking because I haven't thought about it for a while. It's sort of fit with what I was doing at Edgewood to some degree, because in public health, I was really interested in chronic illness as an advocate, but also family hardiness and how people in the family deal with having somebody that has a chronic illness. So it did to some degree, but not entirely. So that was really looking at those areas: uncertainty, family hardiness, and psychological well-being in mothers with chronic illness and how that impacts their family. So, and that helped because my secondary concentration was in child and family studies. So that was a good fit between the two areas.
That's interesting.
I really enjoyed it. It was a challenge, but it was a good one. I'm glad I did it. I have no regrets about that.
So the PhD enabled you to become a tenure track
Right.
faculty member.
Right.
And you later took on administrative
Right.
roles as well.
Right.
Would you be able to step me through some of
Sure.
how that transition happened?
Sure. That was never my plan. This is how my career's kind of gone. That it's not. I didn't plan to do this or that, but then it's happened that way. So I was full-time, and at that point, I think I had tenure. I was pretty close to getting tenure. And Dr. Mary Kelly Powell, that I mentioned her, she was our department chair in nursing. And so she was asked to chair the search committee for the new academic dean, or what we call provost today. So she chaired that search, and it ended up being a failed search. And the committee, the search committee, ended up asking if she'd be interested in taking the job. And for her too, it was never something she was really thinking about doing, but she thought about it and she ended up doing it. And so when she became the academic dean, at that time I was the interim department chair, and the faculty asked me to take that on permanently. And so I thought about it. I even encouraged the faculty, let's do a national search. There's got to be somebody better out there than me to do this job. They didn't want to do that. I said, let's just know we're happy with what you've been doing. If you're willing to do it, we'd love to have you become the department chair. So I became the department chair, and I was a department chair. And then Mary Kelly Powell restructured the college, the academic side of the college, into schools. And so the Department of Nursing became the School of Nursing. The business department became the School of Business. Education department became School of Education. And then we had School of Integrative Studies and a School of Graduate and Professional Studies. Let's see, we had 6. Oh, and the School of Liberal Arts and Sciences. I think it might have been called something a little different initially. I think it might have been School of Arts and Sciences. So we had 6 schools. And then she ended up moving people that were department chairs into dean positions or doing searches for dean positions, like the School of Business. There was a faculty member that was the dean for a while, and then they did a search. So all of that just transitioned over several years. So I was the dean of the School of Nursing at that time, and it was just nursing. And then the School of Graduate and Professional Studies was dissolved because the graduate programs that were really in the schools themselves. So we didn't really need a School of Graduate and Professional Studies. So that one was eliminated. And then over time, see, this is a long history. So we had this, did we have a School of Integrated Studies when Mary was here? I'd have to go back and look. I can't remember. Anyway, I ended up becoming the dean of School of Nursing, and Dean Pribino became Mary retired, and Dean Pribino became the provost, and we did some additional restructuring. And I know at that time we had a School of Integrative Studies. And I still had nursing. There was business, education, arts, and sciences. And eventually I was asked to pick up some of the other areas. And I picked up marriage and family therapy as part of the School of Nursing. And it was like that for a few years. I was still the dean. And let's see, I have to stop and think how this all played out. Then Dean Pribino left, and I was asked to serve as interim provost for a year. So I did that, and Dr. Colleen Gullickson served as the interim dean of the School of Nursing, and that still included marriage and family therapy. And then we were starting to have some financial, just like most small liberal arts colleges did across the country, and many still are, having some financial struggles. And so we were told we had to go down to 2 schools. And so we ended up becoming the School of Nursing, Business, and Health Sciences, and then the School of Liberal Arts, Sciences, and Education. And then over time, let me go back and think now. We had a different provost, and then we ended up with the provost we have now, Dr. Bill Mangan, and he moved education out of arts and sciences into School of Nursing, Business, Education, and Health Sciences. So over the years, I started with nursing and just kept adding on which was a good way to do it because it gave me a test. Okay, like I'm taking on this. Let me figure it out. Let me take on this. Because I don't think I ever could have done it if they just said, here, you're getting all these things at once. I think I would have just been out of my league. So, but I was always lucky or fortunate that there were people in those areas that really knew those areas well that I could count on and trust. So that was really the only way I could take on all the additional areas, was to have somebody in business that knew the school and knew what was going on, somebody in education, same thing. So, and now, of course, we've spread back out a little bit to where we have just nursing and health sciences, which is a huge school in itself because we've added MFT, marriage and family therapies in that school, but now we have occupational therapy, soon to have probably physical therapy, we have radiography, sonography, on and on. So it's that in itself is a huge to run. Same thing business, now that we have the partnership with, I'm drawing a blank, with
Okay.
Upgrade, yes. With Upgrade, I mean, there's hundreds and hundreds of students in business now. We have the DBA. Same thing with education. That's a huge area. So all those areas have just grown tremendously over time, and they need to have their separate schools and separate deans. So that's been a good decision. That was a long-winded answer to your question. I think I'm not sure I even answered it.
No, that's really helpful because when I was doing background research before
Oh,
our conversation, I read that the change from department to school initially occurred in 2006.
that sounds right.
So there's been a lot of
There has.
morphing
There
in the
has.
over the last 20
Right,
years.
exactly. And one of the reasons that happened initially was because when Dr. Mary Kelly Howe became the provost, we had grown a lot. And so she had, I think, 26 direct reports, and she was trying to meet with all of those people weekly, and it was just too much. And that's when she just said, okay, we need schools where I've got a dean of each school, and that person can then be a direct report to her. And that really helped a lot. It helped consolidate things. It helped build more sense of community because people were housed in areas in which the disciplines were similar. And I think that was a really wise decision at the time. What was more difficult was when we then downsized. That made it a lot more complicated. But it was, it was done at the time for financial reasons, and it made sense at the time.
Speaking of the financial part of it,
Mm-hmm.
can you talk a little bit about how the Henry Predlin
Oh, sure.
Foundation money and naming kind of figure into some of these
Sure.
evolutions?
We've been so fortunate to have Henry Prellin Foundation support us, and they not only student scholarships is a huge part of that, but also just the fact they support nursing and business and science has been huge. We bought a lot of equipment through the foundation. We really, when we had probably one of our largest growth spurts, we were out of office space, out of classroom space, lab space. And so they gave funding to remodel the third floor of DeRicci, specifically for nursing. And now, of course, we've outgrown that. But at the time, that was huge because we had nursing faculty spread out all over campus. We had students all over the place. They never knew where to go, where to find people. So to consolidate us all in one space and it was huge for us as faculty to be able to work better together when we partnered with our colleagues in the same space. We had an accreditation visit, and we knew that our lab was pretty low skill. It really was out of date, needed a lot of work. And so when we had our accreditation visit that year, we were told that we had a compliance concern because of our lab space. And sure enough, the Prellin Foundation stepped in, provided funding, and we ended up with new lab space. And that's never been an issue since then. So they have really come through for us on so many occasions. And I think they're just a great, their belief in us and their support of us has been huge over the years. And student scholarships especially, but also just the support they've given for equipment and supplies. All of that's been, and the remodeling of the space has been huge.
I'm curious, as someone who didn't anticipate
Uh,
or plan on becoming an
yeah,
administrator and then spent many years
right.
as a department chair and dean, did you enjoy those roles or was it
Watched it.
more something you did out
A
of a
bird.
sense of service?
Oh, well, I think initially it was a sense of service just because no one else wanted to do it. They didn't want to do a search, and I was like, okay, I'll do it. But I actually grew to love it, and I did some things deliberately to help myself prepare for it. I ended up going to University of Pennsylvania to the Wharton Fellowship, Leadership Fellowship. It was part of a program through the American Association of Colleges of Nursing, and it was a competitive process to apply and be selected. And then that was a great experience. So I tried my best to do some things to help myself learn how to be a better administrator. But really, the best part was I just had great people to work with. I mean, I often thought I probably wouldn't have stayed in that position if it hadn't been for the faculty and the students. Everybody was always so supportive and helpful. And I was just really lucky to work with a great group of people here at Edgewood. Otherwise, I probably would never have done it. But it was because of all of them. I always knew I could trust people I worked with, that they were always willing to step up when We needed them to, they really believed in the mission and vision of the college, which to me was paramount. So I ended up staying in it because of that, really, more than anything else. I never planned to be an administrator. It just kind of happened.
And for the record, just to make sure that we have all
Sure.
phases of the story, when I know that you are still
Mhm.
teaching
Right.
at
Right.
Edgewood
Yep.
University, which we can get to
Okay.
later in our conversation, but when you, I don't know if retired is the right
Sure.
word,
It is.
what was your role when you retired?
So I told the president and the provost a year in advance that I was going to retire. And even when I did, I was still like, I don't know if I'm doing the right thing because I just loved it here for so long and been here so much. That was a good thing for me because it gave me that year to kind of get used to the idea. And Dr. Quinn Mulligan was the person, he was associate dean with me for years. And so I'd been mentoring him with the hopes that he'd eventually move into my position, which is what happened. So that to me was huge because I wanted there to be a smooth transition. I'd been dean for 20 years. So, for someone else to come in, and it's always a good thing to have a fresh set of eyes. But I think of him as having, in a lot of ways, a fresh set of eyes because his experiences have been different. He's been in different roles. And so for me, the fact that he moved into my old job made it much easier for me to retire. At the same time, I still wasn't quite ready to give it up. So I said, I'll teach one course a semester and we'll see how long I want to do that. And I taught two last summer when I first retired, and I'm teaching one this fall. And I'm really enjoying that because I get to know the students again, which in an administrative role, I hate to say it, but I typically only knew the students that were having problems or were problems. And so now I'm back to teaching students, grad and undergrad students that I'm really enjoying getting to know. And it keeps kind of my hand or my foot in the door without being here and being visible. It's all a line course. So that helps a lot I can teach from home and not feel like I'm intruding on. I want Quinn to be able to really take things and run with it, which he has, and not have people coming to me for things, which they have, which is exactly the way it should be. So I'm really glad about that.
Could we talk about some of your accomplishments as dean
Okay,
during those 20
sure.
years? One that often gets cited, I think, is the in addition to the development of the programs,
Sure.
certainly is the development of partnerships
Oh, sure.
with other
Mm-hmm.
with healthcare providers.
Uh-huh.
I know that in my archival research, just in
Uh-huh.
general about the college, there there were long standing
Mm-hmm.
collaborations in other, earlier eras as well,
Right.
before Edgewood
Mm-hmm.
was training nurses. When St. Mary's Hospital had a school of
Right.
nursing, Edgewood was offering
Uh-huh.
degree credit to the
Right.
students there. I'm curious about some of the partnerships that you
Mm-hmm.
developed between Edgewood
Sure.
and healthcare institutions
Oh,
in the area.
well, it's one I can't take credit for, but one I helped continue on is the one I mentioned before with the House of Wellness up in Baraboo. So Joanne Granquist originally started that partnership when she was a faculty member at UW. That's why I think she'd be a great person to talk with. And then she came to Edgewood because she just wanted a different experience than being at a big university. And she continued that partnership was huge for years. And so then she served as a mentor for me, and I continued that for the time I was teaching the public health course. We still have students up there on occasion, not as much as we used to, but we do still have students there. So to me, that's one of the really important partnerships we've had over time. I'd say the other partnership is back, I should know this. How long ago was it? Uh, it's probably in the records, but the Center for Healthcare Education Simulation is another partnership. And the way that came about was nursing was starting to use a lot of simulation in their nursing programs. And the equipment's really expensive. You have to have lots of room for it. You have to have faculty that know about a simulation. And we didn't have any of that at the time. And I knew the chief nursing officer at Meritor, Dr. Barb Pendickenstein, really well. We'd meet on a regular basis. And she was saying the same thing at the hospital. We really need simulation. It's expensive. And I said, well, why don't we, the two of us partner together to try and figure this out? And so we ended up developing this. It was initially called the Center for Nursing Excellence, CNE. Um, During the development of that, we reached out to Joan Banglinger, who was the chief nursing officer at St. Mary's, and she was also interested. So between the three of us, we developed the CNE, Center for Nursing Excellence. We, again, Prelin Foundation stepped in, helped with buying equipment. We got a workforce development grant from the state of Wisconsin to support that. Um, the Renabog Foundation actually gave some funding at the time. So we pulled a lot of resources together and ended up developing the CNE. And now over time that has expanded, takes up a lot more space, lots more people, lots more equipment, and it's called the Center for Healthcare Education Simulation because it's not just for nurses, but physicians, pharmacists, occupational therapists, any kind of health profession. They're all using simulation. So now the center is much bigger than it was when we started, but that's been a really wonderful partnership that none of us could do on our own, but between the three of us, we were able to make that happen, which is really unusual for an academic center like us, an academic institution, to partner with two different healthcare organizations that are typically competitors to pull something together. So I've been really fortunate that's gone so well. Well, and then since then, I was asked to serve on the Meritor board about 12 years ago, maybe. So I've been a board member at Meritor Hospital since then. I served as vice chair and then chair for 3 years. And now I'm still on the Meritor board, but I'm also on the, Meritor joined Unity Point Health, which is a healthcare system out of Iowa. There's 12 hospitals total. And I'm the representative from Meritor Hospital to the UPH system board in Des Moines. So we have quarterly meetings, and I represent Meritor at those meetings and then take information back from UPH to the Meritor board. So that's been another I've learned so much being on the board, and hopefully I've been able to contribute some, but I've learned a lot from that experience, that partnership. And I think that's helped me in terms of being able to help with, things like the nursing shortage. I was talking to the chief nursing officer for Unity Point Health about what Wisconsin did to try and get students licensed quicker than they were in the past. So then she talked to the Iowa State Board to see if they could do something similar. So I'm hoping some of that partnership helps all of us. What's that saying about the boats? How's that saying about boat rises with? I can't think what that saying is. Anyway, helping each other out. That's what's important, right? So that we all get to benefit.
Right. Wow. Are there other accomplishments that you're proud of from your time as dean?
I think one of the most recent ones, we started just this fall, just a couple of weeks ago, this Certified Registered Nurse Anesthetist program. It's a Doctor of Nursing Practice and Nurse Anesthesia. And we talked about it for quite a while. And this is another area where Quinn really shines. He knew several people that were nurse anesthetists. And so we started talking more and more about it. I had a conversation with Dr. Alan Kaplan, who's the president and CEO of UW Hospitals and Clinics, and told him we were getting ready to start a CRNA program. And he said, oh my gosh, we were thinking about starting one on our own, but if you're going to start one, then go for it. And so that's been great because we need UW for clinical sites. They want our students. Same thing with the other hospitals in the area. Once we started a program, they've just been great about coming on board. And so I think that's one of the other partnerships. I really have to give credit to Dr. Mulligan because most of these most recent partnerships are due to him. That includes the partnership with UW Whitewater, where we have students at Rock County. It includes the partnership with Beloit College, where we have students that do their first couple of years with their gen eds at Beloit, and now they're finishing our nursing program through Edgewood classes there. He's really been the leader on getting those partnerships up and running. So while I was dean, he was associate dean out there getting partnerships going. Those are going to really take us into the future and give us more and more students, which we need.
Something that's remarkable to me, at least from my vantage point, is that Edgewood is a real school of choice for nursing in the state of Wisconsin.
Right.
And that seems like a very impressive
Right.
That seems like a very impressive status to
Really
have.
proud of that.
Um,
That's
can you
hard.
can you talk a little bit about what's gone into that?
Sure. That's a good question. Isn't it? If we had a magic wand, well, how does that happen? So
Yeah.
I think it's a variety of factors. I think the mission and vision of the college really means something at Edgewood. And I think people, they believe in it and they live it. And I've often heard people in the community say there's something different about an Edgewood nurse. And I think it's that value of the mission and the vision. I also think it's our faculty in the liberal arts and sciences, those gen ed courses the students take. I think that stays with them. And, they see things differently. They think critically. They are open to other ideas. I think that's a huge part of what makes an Edgewood nurse special. I think we've been really deliberate to hire faculty that are committed to the mission and vision. The faculty are just amazing. They're all still current in clinical practice. They really care about the students. We've got faculty that are in clinical practice all across the board, from clinics to hospitals to public health departments to um, the whole chunk population. They come together to bring that expertise and then make sure it's imparted to students, which is huge. The faculty really support the students, and I think that's so important. Our NCLEX pass rate has always been above the national average for as long as I've been here. And I think that speaks to the rigor that the faculty really uphold, which is hard sometimes because we've been challenged at times to, um, maybe admit students who aren't quite as qualified as we think they should be, or to lower admission standards. And we've just refused to do that, and it's paid off. I often think if you're a patient coming into the hospital, do you want somebody that's maybe not qualified really to be there? I don't think so. But sometimes it's hard to hold those standards because, especially when enrollment at the college is declining and, we turn students away, that sometimes is a difficult decision. So it's always a difficult decision. But I think for the profession and for the health of the community and the nation, it's important to keep those standards high.
Absolutely. Um, and I want to broaden the lens a little bit in a
Okay.
minute to ask you about sort of how Edgewood fits into the
Hmm.
broader landscape,
Right.
healthcare landscape. Um, but I'm wondering if I could follow up because I did want to ask
Hmm.
you, after hearing about um, your major accomplishments as dean, what are your feelings on some of the major challenges you face during your time?
Let's see. Well, resources is always a challenge. As I said, we didn't have a very good lab for quite a while, and then we were provided funding for that. I think finding faculty is always a challenge just because of the fact that you have to have a graduate degree, at least a master's degree. That's easier than it used to be because more and more nurses are getting master's degrees. The doctoral degree is a little easier to find now because of the DNP, but it's always been a challenge. Finding faculty has always been a challenge. Naturally, and this is exactly what we experienced too, there's three main challenges in nursing education: is finding faculty, finding clinical sites, and also classroom space. So the clinical sites situation is an issue for us, just like it is every other nursing program, because there's only so many clinical sites available. You have physicians, medical students, you have pharmacy students, OT, PT, all the health professions are all looking for clinical sites. And hospitals and public health departments, other healthcare organizations only have so many sites and they can only take so many students. One way we've been fortunate about that is particularly some of the places here in Madison give preferential treatment for our students. Obviously not UW because they have their own school of nursing, but Merritt or St. Mary's have been really good at giving us sites. And schools of nursing from out of state come to Merritt and St. Mary's for clinical sites. So it's a tough thing to find enough sites. The classroom space issue has to do a lot with, all the students have to have anatomy and physiology and microbiology. And so if you don't have enough science lab stations, or you don't have enough classroom sizes that are big enough to hold enough students, that's the other thing that makes it difficult to grow your program. So I'd say the three barriers are the same. The three challenges are the same that everybody experiences in nursing nationally, or the lack of faculty, lack of clinical sites, limited classroom sizes.
And my goodness, did you ever overcome those challenges?
I don't
Because,
know. Well, and nursing's expensive to run. I mean, it's probably the most expensive program to run on campus because of the
mm,
equipment and, all the things that go into the prereqs for the sciences, all the lab equipment. It's an expensive program to run. So students pay a premium, they pay an extra clinical fee for the cost of offering those programs. But somehow we've made it work.
and when I was walking down the hallway the other day, I saw the board listing faculty offices.
Oh,
I think they had to add an additional
we
panel.
did. We have, in fact, that's way out of date. Well, I'm trying to think the last time that was probably 2 years ago. So there's about 90 nursing faculty at the college now between part-time and full-time. So, and that's been another challenge over the years is that, we've added more and more faculty, but it used to be we were mostly full-time faculty with a few part-time faculty. But especially after COVID hit, more and more faculty went back to work at clinical sites because the pay is so much better. And so now they teach for us part-time and then they work their full-time jobs at clinical sites, mainly because the pay is just, I mean, our students, when they walk across the stage, they're already making a lot more money than our PhD prepared faculty are making. So that's another reason for the faculty shortage is not just finding people with the credentials, but finding the people that are willing to take a pretty significant pay cut to teach. But I always tell people when, they think about teaching that it's a lifestyle choice. You don't have to be someplace from 8 to 4:30 or 11 p.m. to 7 a.m. And, it's your hours are more flexible and you get to work with students, which is a real joy. So I always try and kind of encourage them to think of it in a different way besides all the pay. That's probably never going to catch up to the clinical sites.
Sure.
Yeah.
My goodness, from 9 faculty members when you started to 90.
Oh,
I
it's
didn't
huge.
realize the growth
It's
had
been
been a
huge.
factor of 10.
Well, when I first started, we only had one undergrad program, and I think we had 16 students in the undergrad program, and we had two master's programs, a master's in leadership and a master's in administration, and I think we had maybe 15 grad students. So we had a total of about 30 students total in the Department of Nursing. And now between undergrad and grad, we probably have maybe close to 600 or so students. So it's been a huge increase. Same thing with business and education, those areas too, but large increases in enrollment, which has saved the college during these lean times.
It has. And I want to, as we move towards the end of our interview, I want to bring it back to the college and to the
Okay.
university transition and
Right.
looking ahead. But I do want to just conclude this portion by asking you sort of how you see Edgewood nursing
Uh-huh.
fitting into the healthcare
Mm-hmm.
landscape in Wisconsin or,
Sure.
or nationwide. It's something you've referred to a couple
Sure.
of times, and I'd be curious for your reflections on that.
I was thinking about this the other day because when I started, Edgewood was really fulfilling a community need. And that's always been our focus is what does the community need? We have an advisory board in the School of Nursing that we meet with on a regular basis. And they're really the leaders of healthcare in the city, well, really all of Dane County, South Central Wisconsin. And so we say to them, what do you need from us? When our students graduate, what do you see as gaps or what sort of things do we need to improve upon? And they've been a great resource for us. But our goal has always been to really fill a need for nurses in the community. Now, I would say that's really expanded because of our online courses. I mean, we have students all over the country. So it's not really our local community, which is still our main focus, but it's really nationally. How can we help support the nursing shortage at the undergrad level, but also obviously at the grad level, the DNP, and particularly the nurse anesthesia program and all the other healthcare programs that we're offering. There's a lot of shortages in terms of healthcare professions. And so I see the School of Nursing is going from this small little program of, 16 undergrad students and maybe 15 grad students to help the hospitals in the area to being this, really massive school that provides students all over the country, both at the undergrad and the master's and the doctoral level, it's really amazing. It makes me happy because I feel like this, community's always said there's something different about an Edgewood nurse. So I hope we see that all over, the country. There's something different about these students that are graduating from Edgewood University now. So that's a good thing.
That's a phenomenal vision. I love that.
It's amazing how much we've grown. It's just incredible.
And you've set up the transition to my next question
Okay.
perfectly, because you've referred to the mission and
Mhm.
the Dominican values several times in our conversation. And I did want to ask you, is there a specific core value, truth, compassion, justice, partnership, community, that speaks to you in particular?
That's a hard question because to me, they're all so intertwined. It's hard to kind of pull them out. I've often said that you can't be a nurse really if you don't believe in all those values because, you want someone who's compassionate. You want somebody that believes in partnering with others. You're always part of a healthcare team and part of a healthcare community. Um, just the community piece itself. So it'd be hard. Maybe compassion might be the one that I pull out, but in my mind, it's hard to picture pulling out any one value because to me, they're all so interrelated. I'm not Catholic. And when I started here, when I interviewed, I was worried about that. And I met with the nursing faculty and I said, I'm not Catholic. Is that going to be an issue here? And they just laughed and they were like, well, this part shouldn't be recorded. But they were like, none of us are Catholic and we love it here. So I think, who doesn't believe in those Dominican values? I mean, it's just, they're so, especially in today's age, they're so critical to everything we do, everything that we support. And it's hard to imagine not believing in those. And I think they're more important today than they've ever been. Probably shouldn't have said that one
Ab-
more. You have to
no,
do something enough.
no, absolutely. And you remain involved, as you mentioned earlier, you remain involved with Edgewood, teaching part-time.
Right.
Is that something you anticipate doing for the foreseeable future, or do you have other plans for the next
That's a good
chapter?
question. Well, my husband's been retired for a couple of years. That was another reason I retired because he was like, how much longer are you going to be working? But I couldn't quite give it all up yet. So I plan to continue to teach again next spring. And then we'll just see, maybe another year. I'll be 70 next year. My goal was always to teach until I was 70. So we'll see how things go. I like teaching online because you can really do it anywhere. So we could still travel and I could, work in a library or work from home. So it kind of depends on how long Edgewood wants to keep me and how long I want to keep teaching. But I'd say for at least another year or so, I'm planning to do it. I feel like working with students is so, it's just energizing and engaging. And the faculty that I work with every day, they're just incredible. And I learn so much from them. I feel like I get more from them than what I'm giving. So it probably depends partly on how long they want to put up with me. But I think Edgewood really has a valuable place in terms of higher education, and I want to see it contribute into the future. Especially now that we're at university status, I think that means a lot, particularly for people overseas, which college is more of a high school setting. So I think for those students particularly, but also for here too, it's important to recognize that we have thriving, strong, huge graduate programs that make us more of a university than a college.
Are there any thoughts about the college to university transition that you'd like to share, or any thoughts about the Edgewood University of the
Sure.
future?
I think it was long overdue. But of course, I'm coming from a background in which we've had, graduate nursing programs since I started here. We started with the two, and now if I stop at count, we probably have at least a dozen or maybe even 15 different graduate programs in nursing. So to me, it's something that it's a decision that's appropriate. It's long overdue, as I said. I think it will help us, especially with overseas, with international students, which is important. So I'm really glad that we've made that decision and moved forward with it. I know it was a lot of work. I think it was a lot more work than most people thought it would be. And, it costs money to do that, but I think it's a long-term investment that was good for the university.
I want to give you an opportunity to share anything that I didn't ask about that I might have missed in our conversation, because this interview has been extremely informative
Good.
about one of the seminal transformations that Edgewood has undergone as an institution.
Right.
So I'm very glad. I appreciate your taking the time to step through so much of it with really in
It's fun
detail.
to do it because, you kind of just keep going day to day and then you stop to think about all the things that have happened and all the changes. And, I think we've just been really fortunate here to have great people. I think back on some of the faculty that, are no longer with us, passed away. And, the leadership they provided to the college over the years has just been really instrumental. The leadership teams we've had at the college, when I think about Jim Ebbett and Dan Carey, they've just been so supportive of the college, even after they left the college, still being supportive of us in the community, which is huge. So I think we've been fortunate to have good stewards over the years. And of course, the sisters, unfortunately, we don't have as many as we used to, but they were just great. I was so impressed when I came here about someone who's non-Catholic and didn't have any real knowledge of what it's like to even be Catholic. I'd never even met a nun until I came to Edgewood. I was so impressed with their leadership and their advocacy, particularly for justice. I miss them a lot, but hopefully we've got other people that carry that on to some degree. And it's been good to kind of go back and think about the past and reflect on that and where we're moving into the future, which I think is bright for us. I think we've been fortunate to weather some of the financial storms that a lot of colleges have done. I think we're in a good place for the future.
Well, Margaret Noreuil, thank you very
Thank
much.
you very much for asking me. It's been a joy.